Namaste. Let's take up a single case study on treatment of phosphenes today, the summary of which goes so. A female patient aged 27 years who was an employee in MNC had mainly complained of recurrent episodic visualization of anavasthita chala shyava rupas of different shapes associated with Ardhashirashola, Harillasa, Aruchi, and Agnimandya since many years. All these symptoms were said to increase on anidra, divaswapna, intake of excess shita ahara like ice creams, cold drinks, etc. Along with this, she also had gradual and atishaya vriddhi of sharira gatra, that is weight gain, guru gatrata, heaviness of body, and alpa artavasrava since many years. The medical history was so. Patient had few episodes of afebrile seizures during her childhood. She had taken allopathic treatment for the same and had no more recurrence of seizures till date. The current complaints of the patient were diagnosed as an outcome of migraine and its aura at an allopathic hospital, and the patient was on allopathic treatment since recent past. But as she was able to get only temporary relief from headache and other GI related symptoms by this treatment, and as she had no relief from visualizing asadrupas, making her feel very anxious and depressed, she had consulted seeking Ayurvedic treatment majorly for this ailment, that is visualization of asadrupas. The findings of Rogi Pariksha was so. The patient was of Kapha Pittala Prakriti and was of Avara Sattva. She was mainly in Deena and Bheta Avastha. The patient was also Sthula. Long interaction and Prashna Pariksha with patient revealed the Nidanas in this case to be so. There was indulgence in Kapha Vatakara Nidana like Ratri Jagarana Divaswapna, Ati Sevana of Shita Ahara, Ati Yoga of Chakshurindriya by the very nature of her work, and long history of indulgence in excess physical and mental strain since many years. Based on all these, the Samprapti in this case was found out to be so. Long history of indulgence in Kapha-Vatakara Nidana along with Ati Yoga of Chakshurindriya had led to Kapha-Vata Prakopa, causing Kapha-Vataja Shiro Roga, which was mainly mimicking the symptoms of Ardhava Bedaka, and Asamyak Vishaya Grahana by Chakshurindriya, causing Darshana of Anavasthita Chala Shyava Asadrupas by Chakshurindriya, which is usually described as phosphenes by contemporary science, along with sthaulya and other ailments. Contemporary science describes phosphenes as visual sensations of light, such as spots or flashes, that appear without any actual stimulus. They are usually harmless but can sometimes indicate underlying serious issue. Phosphenes can be caused by a mechanical stimulation of eyes, like rubbing of eyes, stimulation by light, that is seeing spots after exposure to bright light, or by abnormal neurological stimulation, as in migraine, optic neuritis, and other complex neurological disorders. They are described by their shapes, colors, or movement, such as geometrical shapes with different colors and glow, zigzag lines, etc. Coming back to Ayurvedic Chikitsa in this case, based on Nidana Panchaka and Samprapti, and mainly Samprapti, as this case was diagnosed as a case of Sthaulya along with Kapha Vataja Shiro Roga, Sarvanga Udvartana and Sarvanga Abhyanga Sweda, followed by Sadhyo Vamana, were administered in the following manner and with following precautions with regard to the Avara Sattva, Dina Bhita Avastha of patient, and with regard to history of seizures. Udvartana with Kolakulattadi Churna and Taila Abhyanga with Abhayamalaka Taila was carried out on alternate days for 4 days. Continuous Udvartana alone was avoided to prevent Vata Prakopa, and continuous Tailabhyanga alone was avoided to prevent Kapha Prakopa. And both these were carried out as Purva Karma to Sadhyovamana and for attaining Medo Pravilayana and Kapha Vilayana without causing Vata Kopa. Sadhyo Vamana with Yashti Fanta and Kshira was administered after anointing complete Shiras with Narikela Taila to prevent sudden attack of headache and anxiety which might have occurred during or post Vamana. Samsarjana Krama was advised after Vamana. Half teaspoon Panchagavya Grita was given for Shamananga Snehana every day at Nishi with Madhu after Samsarjana Krama was completed. And the outcome of this chikitsa was so. Visualizing phosphenes, aruchi, hrilasa were completely reduced after the end of Samsarjana Krama. Recurrence and intensity of Shira Shula gradually got reduced after 2 months. And also, Lakshanas and Upadravas of Staulya gradually got reduced after few months of proper intake of oral medicines and after following proper food and lifestyle. So, the takeaway from this case study is that the product of precise Ayurvedic diagnosis paired with proper treatment plan and proper precautionary measures will perpetually be productive, and this cannot be attained by chikitsas which are planned just by drawing parallels from Western medical science. Thank you.